Well, hi everybody. Happy Wednesday. It is July 21st, 2021. Hard for me to believe, and I am Kim Bergen-Jackson, the administrator at Oaknall, and today's my Wednesday. I want to say that I'll start with the good news. Oaknall's COVID-free, which is always good to know, and all vaccinated. So those are two things we don't even need to talk about anymore. Unfortunately, if you look on the coronavirus iowa.gov website, which they're only updating once a week these days, you'll see that the county positivity in Johnson County went from 1.9% positivity to 4.4% today, with the last 7 days being 5%. So we do have an increase in cases in our county, in our state, in some states very badly, Missouri included, and I would say the majority of those cases are unvaccinated people, and it is probably the Delta variant, which is the prominent variant right now in this country. So on one hand, you can feel protected from that Delta variant because we're all vaccinated. And on the other hand, you have to be vigilant because the Delta variant is 200 times more contagious than the original COVID variant, which is normal virus development, right? The COVID virus is not doing anything that's unusual. That's what viruses do. They hop around and they change as their situations change. So it's very common to have a variant. The vaccines, all three of them, the Pfizer, Moderna, and Johnson & Johnson vaccine, are proving to be protective of this variant. Johnson & Johnson less so, but for the majority of staff and residents here, we all received Pfizer or Moderna, which is holding steady and protective. So it doesn't mean you can't get COVID since you're vaccinated. It means that if you do get COVID, you won't likely be hospitalized or experience any moderate to severe symptoms. You could still experience some symptoms. I was nervous when I got my cold this week, but I have confirmed it's not COVID. It's now bronchitis for me, so I have a scratchy throat and a terrible cough, but not COVID. So there are other viruses out and amongst us that have been around forever, but now that people are taking their masks off without the mask mandates, those other viruses are around. So in children, they're seeing an increase of RSV, which is a common cold for you and I, and for children, it's a severe respiratory virus. There's more colds, of course, and COVID is still very dangerous. So if you have family that you're worried about that are refusing to get vaccinated, if you could just encourage them to follow the CDC recommendations. I know you have been trying to get people vaccinated, but as long as there's a large number of people unvaccinated, this virus is going to continue to mutate and roam around and wreak havoc. So the head of the CDC called it this week what did she say? The pandemic of the unvaccinated. And so they're seeing a lot of people in the hospital. The majority, I think 99.8% of the people that are hospitalized at this point in time in this country are unvaccinated individuals. And so that speaks volumes to the vaccine as far as I'm concerned. But I do know of vaccinated individuals who have converted to positive cases. Both of the individuals that I know were only mildly symptomatic. No one had to go to the hospital. I asked for some information from public health this week about the prevalence of positive breakthrough cases, is what they're calling them. And there are 5,900 cases in the United States. Of those 5,900 cases, I know of 2. So that seems highly unlikely that I would know of 2 already. I would say that we're not testing regularly anymore, so we don't really know if people are asymptomatic or only mildly symptomatic. Again, I don't want to panic anybody because you are protected. If you're going out to the grocery store or the banks, I've said all along, you should continue to wear a mask. I was at Hy-Vee this weekend, and we were probably the only 3 people in the store that had masks on, or at least that's what it felt like. So shop early in the day if you can. Stay away from crowds. Summer events are fine if you're outside. Wash your hands. keep up those COVID precautions that we've used so well over the past 15 or 16 months. And if you experience a sniffle or a sore throat or a cough or a fever or a terrible headache, let the apartment nurse know or let me know, because we have ample supply of the rapid tests right now. I don't know if that'll always be the case, but right now we have plenty, and they expire after a certain amount of time. So if you truly think you had an exposure and you are worried that you might have contracted COVID, I would rather test you than not test you. Please also stay vigilant with your guests. If they're coming into the campus, any campus, they should be vaccinated if they're going to be in the common spaces. So if you want them to eat with you in the dining venues, or you want them to use the pool or the common areas, they should be vaccinated. That doesn't mean they shouldn't wear a mask. They should also wear a mask because they're not in our bubble. And so our bubble is getting bigger because we're experiencing more and more people. Do I think we're going to have an outbreak at Oak Knoll? I don't, because we know how to do it, right? We know how to limit our exposure and take care of each other. That's the only real reason that we haven't experienced, a total outbreak in the number of people that are here. Between the staff and the residents, we're looking at about, close to 700 people. So the only thing I can think of is that the community has been protecting each other. So not just me, but all of us working together in collaboration to keep everybody safe. So stay vigilant. I know you're tired of hearing about it. I'm tired of saying it, but we don't want to regret making a mistake later that will affect people. Enjoy the summer music festivals, though. BF Burt was here last week, and last week at main campus, and this week at East, and wildly, he's a favorite. What can I say about Kevin BF Burt besides he's a great musician and a wonderful crowd mood picker-upper. Keep doing the things you're doing. Keep going on vacation. Just be careful. I think you know now as well as I do how to prevent COVID from getting into your life. You've proven that you're an expert, and we still get to do the fun things, but watch out for the people we don't know. Those are the people we have to worry about. So I think that's it. If you didn't catch Dr. Fauci fighting with Rand Paul on the TV yesterday, you should Google that, because Dr. Fauci tried to put Rand Paul in his place, and it was great from my perspective. Anyway, that's just a little fun thing for you to look up if you're interested. Stay safe. Have fun. I'll see you in 2 weeks. Let me know if you have any questions. Thanks.